So today we're going to talk about anemia. Anemia is reduced levels of red blood cells or the reduced ability of red blood cells to carry oxygen. So the body doesn't have enough healthy red blood cells, and as you know, red blood cells provide oxygen to body tissues. So classic anemia symptoms are fatigue, muscle weakness, and pale skin. There's many types of anemia. However, we're going to touch on 5. So the first one is going to be iron deficiency anemia, and it occurs when your body doesn't have enough iron. Like a lot of times it's from inadequate diet, could be chronic blood loss. But as you know, like I said, iron helps in the production of making red blood cells. Iron deficiency anemia, though, is the most common form of anemia. The next anemia we're going to talk about is folate deficiency anemia. It's caused by having too little folate, which is vitamin B9, in your blood. And similar to iron deficiency anemia, folate is also necessary for creating red blood cells. Pernicious anemia is caused by vitamin B12 deficiency and or the lack of the absence of intrinsic factor in a person's gut. The patient will have red, smooth tongue, of course fatigue, loss of appetite, and the cells on pernicious anemia will be unusually large and can sometimes appear oval. Thalassemia, actually the next 2 anemias are inherited blood disorders, which is thalassemia and sickle cell anemia. Thalassemia is when the body makes an abnormal or inadequate amount of hemoglobin. And then, as you know, hemoglobin is the protein in the red blood cells that carries the oxygen. So your patient, again, will have fatigue, but could have slow growth, dark urine, and will require regular blood transfusions to manage the iron overload. Sickle cell anemia is also an inherited blood disorder. The patient will have an abnormal hemoglobin S. Normally, your red blood cells are flexible and round, and they move easily, obviously, through all your blood vessels under normal circumstances. In sickle cell anemia, the red blood cells become rigid and sticky, and they're shaped kind of like sickles or moons. They kind of have an elongated shape. When they're irregularly shaped like that, they get stuck in blood vessels, which can slow down or block blood flow and oxygen to parts of the body. Therefore, it causes severe pain. There's really no cure for sickle cell anemia, but the treatment is to relieve the pain and help the problems associated with it.